Hello everyone, welcome to the 2023 April HR Notes lecture series. If you don't know already, HR Notes is an organisation providing high school resources to enable success for all students, especially our Year 11 and Year 12 students. So there are numerous resources out there to help you achieve this. There are study notes, basically hundreds of downloadable study notes made by students across the state. So, for example, if you wanted to search up HHD Unit 3 Study 2 notes, you'll find probably dozens of notes by previous students that could help you understand the topic and really summarize it into the most condensed versions. Now, we also have lectures like the one you're attending now. We have discussion forums, so if you wanted to ask a question like, hey, how do I answer this question about the World Health Organization prerequisites? I'm sure it might have been asked already. You can check those answers, or you could, write a question and someone out there will be more than happy to help. You can even ask things about uni, how uni's going, courses, study scores. So it's sort of like a support group, and yeah, really recommend checking that out. Then we also have a range of other resources like articles and HR calculator and newsletters, and I definitely used all three of these very heavily throughout my Year 12. So yeah, check those out. We also have TuteSmart tutoring. So HR Notes has TuteSmart tutoring, and it's basically online and from recent Year 12 graduates. Right, so it's really accessible because it's online and it's from students who have done really well in that subject. I personally am a HHD tutor at TuteSmart, and yeah, I really hope to see some of you guys there. We also have study guides available, printed revision materials with top tips from elite students who did really well in the subjects. Alright, so I use some of these pretty much as like my holy Bible during Year 12, because they had all of these really, really good tips to help you get great marks in terms of answering exam questions, in terms of, actual content, summarized in a way that is like really easy to understand. Then we have Ed Unlimited, which I like to call the Netflix of VCE resources. It's basically hundreds of top study guides in one place and also topic tests. So if you want practice questions as well, you also can have access to them over there. Special thanks to La Trobe University, RMIT University, Deakin University, UTS, and Macquarie University. Without them, this lecture wouldn't have been possible. La Trobe University also has an Aspire Early Entry program, so I highly recommend checking that out in terms of, early conditional offers to La Trobe University. Alrighty, so a bit about myself. Hey everyone, I'm Alicia. I graduated last year and I'm currently doing a Bachelor of Law Honours in Science at Monash University. I got a 98.15 and I'm a HHD tutor at TuteSmart. I got a Raw 15 HHD, and those are all the subjects that I did, and I love eating and travelling, as you can see in that photo. Nothing like a good milkshake. Today we will be covering all of Unit 3 of Study 2 and start of Unit 4 of Study 1. Alright, and there's not going to be any designated breaks, so whenever you need, feel free to pause. We will be using a Q&A software, so you can ask questions and receive answers to them. So just chuck them in and I'll be able to send a reply back in the chat. So yeah. Key knowledge. So if maybe some of you might recognize it, but these are the top points from the study design, right? So if you haven't already, please, I highly recommend printing out the study design, or at least having like a copy available that you can annotate, because it's really important. It's kind of like the only things that VCAN can like assess you on, right? So as you can sort of do a traffic light system. I know I did that for some of my subjects, in terms of green for the things I'm confident in, yellow for the things I should go over a bit more, and red for things that I just absolutely need to learn and clarify, to help you ensure that you're not having any missing gaps, because any number of these things could be assessed on your Saxon exams. Alright, so these blue ones are Unit 3 of Study 2, all of Unit 3 of Study 2, and the green one is Unit 4 Area Study 1. Alright, so have a checkout of the study design. This is the key knowledge. We also have the key skills. these are the Unit 3 of Study 2 skills. So we have things like analysing data, drawing conclusions, a lot of analyse questions for Unit 3 of Study 2, applying action areas to case studies and data, evaluating initiatives, drawing conclusions. So it might seem like a lot right now, but when you actually expose yourself to more and more questions, it becomes much easier because you'll be able to formulate a way, like a new strategy that you can constantly use to tackle these questions. And for Year 4 of Study 1, it's basically about describing, because that's the first stop point. It's just the basic understanding. All right, what is public health in general? Okay, so when we're learning about the first stop point, which is about improvements in Australia's health status since 1900, we're basically being like, what are the different models that the government used to ensure that Australia's health status improved, right? Because the life expectancy from then and now is like significantly changed, not only in Australia, but around the world. Okay, we're focusing on Australia though, but also for your information around the world. And it's basically due to this concept of public health in general, old and new. So first of all, what is public health in general? It's the ways in which governments monitor, regulate, and promote health and well-being and prevent illness, right? So you don't really need to know this definition, but this is just important to contextualize what old and new means. Back in the day, infectious and parasitic diseases were the leading cause of death in Australia and around the world in the 1900s. So we're talking like measles, smallpox, polio, TB, syphilis, typhoid, cholera, all of these really nasty diseases that, didn't really have any medications available, didn't really have any cures. So loads of people died and many didn't know how to prevent it in the first place. So yeah, it's really sad. Some of these have been eradicated, like polio, but some still happen today, especially in poorer countries. But in Australia, we're lucky to have way less incidents of these and definitely very few fatalities from these. But the main reason back in the day they were so deadly and so prevalent was due to the living conditions. Like, there was contaminated food and water often, and lack of safe sanitation and waste removal, and human waste removal. So feces and urine might contaminate your drinking water and food, and you would have these really nasty pathogens and bacteria and viruses entering through just contamination. So that caused a lot of disease, and obviously without antibiotics and things, people just died. Nowadays, though, infectious diseases contribute to way less deaths, and so do injury and poisoning and respiratory diseases, because we have found ways to ensure that the living conditions are suitable and less suitable for the pathogens causing these diseases to live in. All right. So the first subtopic of public health is old public health. And it basically relates to government actions, so public health, that focus on changing the physical environment to prevent the spread of disease. So this was the really first government initiatives. It's sort of just like a phase in the government's initiatives in this first step towards preventing illness, right? Because until then, it was sort of just like, look, you guys are dying, but we can't really do much about it. Whereas once there became more of this shift towards old public health, it became more about the government is implementing their own actions to change the physical environment to prevent the spread of disease. All right, and some examples of actions taken as a part of old public health include providing safe water, strict quarantine laws, sanitation and sewage disposal, improved nutrition, improved housing conditions, and better work conditions. All right, so basically what these mean are, think about like a really crumbling old household. It's just been rained in, blah, blah, blah. The issues that can arise as a result of this include that there might be mold growing everywhere, right? And that can mean increased risk for respiratory diseases and things. So think like, if there was mold and you inhale it, there might be a bacteria entering your lungs, causing pulmonary diseases, etc. then if you have like a house that's crumbling, literally the roof might cave in, then people are more likely to die as a result of injury. And same with sanitation and sewage disposal, is that if there's human feces and urine in like contaminating drinking water and food supplies, there's going to be pathogens entering it and people dying as a result of diseases. So it's really good to like at least know a couple of these really well so that you can explain, hey, these are the actions taken as a part of old public health, and this is how it improves life expectancy and health status in Australia. Alright, so first question is from VCAR 2021. Alright, so there are two things I want you to know sort of when you're tackling these questions. Number one, it's really good to have sort of like a rule of thumb time limit. Alright, so for HHD, it would be like 1 minute per mark for the exam. So working towards, like, you might not be able to do that right now, but by the end of the year, when you're like at your peak performance, you should be able to answer roughly 1 minute per mark. I'm not saying you would spend 10 minutes on those 10 markers, you might spend 15, and you might only spend 1 minute on like a 2 marker, right? But it's just sort of that general rule of thumb, it's averaging 1 minute per mark. The other thing I want you to note is, in HHD, especially recent exams, we've been getting a lot more of these really like complex graphs. So this one is alright, it's pretty understandable, but there are more complex graphs and also really long case studies. And like many subjects with case studies, you won't find that you have time to read through all of it during reading time. So the thing you should do is read the question first and then look at the case study, right? And it seems pretty, obvious, but the amount of times that, I myself have wasted time because I decided to read the case study and realized that I didn't actually need to know like half of that information to answer the question. So, and sometimes you won't need it at all, right? Unless it says in this graph or in this case study referring to the case studies, you often don't even need to refer to it. So read this first and then read this. So in this case, all it's saying is select one of the leading causes of death on the graph and describe how the actions from old public health can reduce global deaths. Okay, so you just have to pick one of these leading causes and link it to how old public health could have reduced global deaths from that. I personally would probably stick to communicable because the keyword is old public health, right? And old public health is really focused on reducing the spread of disease by changing the physical environment. So diarrheal diseases are often spread through like contamination, and old public health had a really huge focus on reducing them. The other thing is lower respiratory infections, okay? Because you're improving housing conditions could reduce like the amount of mold in the house, reducing the risk of lower respiratory infections, increasing the chance of survival, increasing life expectancy overall, right? So basically what the exam report says is roughly the same thing. Leading cause of death, diarrheal diseases, that's the one that this student has picked. And global deaths can be reduced by enabling access to sanitation and waste removal, right? So that's the action. By removing human urine and feces and containing it, the risk of contaminating drinking water or food supplies with pathogens is significantly reduced. Okay, so it's not saying it's gone completely, because there still is a risk, it's significantly reduced. This reduces the risk of, and that's like a really common phrase you should probably integrate into your answers, reduce the risk of. Because nothing is certain in HHD, it's sort of just, these are risks that we can manage and reduce. Of contracting and transmitting diarrheal diseases, which can protect vulnerable individuals with weak immune function, reducing global deaths. Okay, and it provided a really clear link to reducing global deaths, right? If you don't include those 3 words in your answer as well, you probably won't get the marks. And if you didn't say like a specific example of an action, like safe sanitation and safe sewage disposal, or improved housing conditions such as this, then you won't get the marks, okay? As you can see here, 39% got 0, and the average was 0.9, so it's like halfway there. But to be able to answer this, all you need to do is know the action area and know how to answer the question, all right? So It's 2 marks and it can be easy to make a silly mistake, but as long as you practice these sort of questions, which are very common, you'll be able to get it. Right, now for the second half of public health, we have the concept of new public health. This basically relates to expanding the traditional focus on individual behavior change, and it's more talking about at a population level, the physical, socio-cultural, and political environments impacting health. Right, so some examples are, it's mainly relating to health promotion, by the way. So health promotion is the main thing that is being focused on in new public health. These include road safety education programs, laws about smoking indoors, food labeling initiatives, laws limiting alcohol marketing, taxing sugary drinks. All right, so the government has played a huge part in this in terms of creating laws, implementing programs, funding them, and other organizations as well, right? And it's all about ensuring that there is less friction to make good choices, okay? And this became more of a focus once our infectious diseases got reduced, but our non-communicable diseases increased, okay? So once cardiovascular disease, once our lung cancers and our cancers in general, once all of those sort of diseases started to increase and become leading causes of death, the government was like, okay, look, keep our old public health model in place to reduce infectious diseases, but we're going to also start addressing lifestyle factors through health promotion under this model of new public health. Okay, and yeah, really important that you know 1 or 2 of these examples so that you could say, this is how it's linked to health promotion and new public health. Alrighty. So we have another practice question from VCAR 2018. It's a 3-mark question. Okay, so it's one of the first exams for this study design. And it's basically saying, analyze one way in which new public health may have contributed to improvements in Australia's life expectancy over time. Okay, when you're analysing, you're providing a bit more detail than when you explain. Okay, so the mark allocation for this is basically 1 example of new public health. You have to have an example, whereas you probably wouldn't get the marks. 2, an in-depth analysis. And 3, link it to life expectancy improvement. Okay, so a sample answer that I've provided is, okay, 1 strategy of new public health is to focus on the prevention of disease rather than the treatment, such as by educating and improving health literacy, right? 1 example of this is the SunSmart campaign, implemented to raise awareness about the risks of UV exposure and how to reduce it by wearing sunscreen. Okay, and yeah, a lot of you guys would be familiar with that because most of us were educated about this in our schools under this model. This can reduce the risk of skin cancer and thus improve Australia's life expectancy over time. 1 example of a high-scoring response from the exam report is this one, and this one is a really good example in terms of really linking it to health status improvements. And as you can see here, students who chose like an example were more able to discuss it and link it to improvements in life expectancy over time, right? So people who chose a health campaign like SunSmart or road safety or quit smoking and quit Victoria, were actually able to better answer this question than if you just sort of rambled on about new public health improving health. Okay, you need to be really specific in your answer because HHD is all about specificity, conciseness, and formality. Okay, so in this case, the first sentence of the answer is talking about how 1 being through health promotion campaigns, and then it underlines this idea of promoting healthy behaviours and educating people on the effects of unhealthy behaviours such as smoking. This improves health literacy and empowers them to take control of their own health. By knowing the adverse effects of smoking, people are less likely to smoke, right? This reduces the prevalence of CVD and improves life expectancy. So it's a really good example in that it draws on a range of examples and then it really narrows in that 1 example and how it improves life expectancy over time. If your answer didn't have improving life expectancy, you might not have gotten the marks because you didn't actually link it or answer the question. The other thing I want you to note is only 58% got 0 marks, okay? Only 10% got the full marks. So these sort of questions, it's very easy to lose marks by things like not being specific enough and not like actually answering the question, which is very clear, and it's about analyzing improvements, right? Through like an example of new public health promotion campaign. Now, so we've done old public health, we've done new public health under the first dot point. Now we're doing the biomedical model and the social models, okay? And these are all part of this models of health, but they're sort of separate from the old and new. The thing you need to know is the social and new public health are really closely interlinked, and they're pretty much very similar, but old public health and biomedical model are very, very different. So don't make that mistake of like conflating the two just because new and social are really similar. Biomedical and old are very different. Okay, so you might be like, what is she talking about? Here it is. Biomedical model focuses on physical and biological aspects of disease, and it's done by health professionals, right? So when you get that image of the healthcare sector of people wearing scrubs and stethoscopes and things and doing x-rays, that's what that biomedical model of health is talking about. And it's associated with the diagnosis, the cure, and the treatment of disease. Okay, and these 3 words are so crucial when you're answering your questions on the biomedical model, because it basically summarizes what it does in the most concise way. When we're talking about diagnosis, it's about like testing if someone has that condition through like x-rays and things like that, whereas treatment is all about the care and management of the illness, right? So this can reduce the effects of the disease or prolong life. Example is like chemo, surgery, transplants, etc. Okay. And it's really important that you're able to analyze the strengths and limitations of the biomedical model and the social model, because, you know, the VCAT dot point says so you really should know. So some strengths are that the biomedical model advances medical technology. It ensures that people are not dying from very common problems like the common cold, whereas in the past they would have. And it prevents premature death, improving life expectancy. But the bad things, the limitations, the weaknesses, it's costly. It's very expensive because you're relying on health professionals and doctors. And they need to be paid for, they need to be trained, you know, they need to have all of these things, and it's really expensive. Not only that, you need all this health equipment, right? So x-rays and things and all these surgery cameras and all of these new medical technologies, they don't come cheap. So it's pretty expensive. Not only that, it's not always promoting good health overall, because the focus is on treating the condition and the symptoms once the symptoms are present. It's not focusing on the prevention of the disease, okay? So it's really important that you understand that while the biomedical model is good, there are limitations, and it needs to be used in conjunction with the social model. And not all people can afford to like go to the doctor or go to surgery or whatever, and not every condition can be treated in the first place. So many might still have high morbidity and mortality levels. So yeah. All right. But yeah, you can still have better quality of life because some conditions can be managed, not cured, but managed with medication. So yeah, x-rays and of course money, because the healthcare sector is really expensive and a huge, has a lot of money making things going on. The social model of health. So this is really closely linked to new public health, right? This is what I was saying. But please don't like conflate old and biomedical, but you can slightly conflate new and social. And it's talking about improvements in health and well-being. And this is achieved by directing efforts toward addressing social, economic, and environmental determinants of health. And it's focusing on things like lifestyle factors. Because, like I said, the social model and the new public health model, they're trying to treat diseases, prevent diseases that are non-communicable. And things that are caused by, less people are having like active work things. Not many people are like outside and out and about being very fit during work. A lot of people are having office jobs, from like the 1970s or so. Lots of people are smoking and realizing that smoking is actually causing lung cancer. Then there's, of course, more fast foods being available. So once all of those factors started to, manifest in like more cancers, more lung cancers, more CVD, because of like, all the fats blocking the arteries in the heart, we were like, oh no, we really should focus on the lifestyle factors and teach people, hey, you should take control of your own health. Right, so these include funding of road safety education programs, smoking indoor laws limiting alcohol marketing, taxing sugary drinks, etc. Okay, and the principles of the social model of health, there are 5. And the acronym that I used for was AREAs. Some people use I, area, like the letter I, area. But either way, whatever you do, it's really important that you remember each of these. So, enabling access to healthcare, reducing social inequalities, empowers individuals and communities, addresses broader sectoral collaboration. Okay, so I'll be going over this on the next slide as well. So don't stress if you didn't get that all down. Yeah. So acts to enable access to healthcare, it's basically saying we need to make sure that health services are affordable, accessible, and relevant to people's needs so that they're actually culturally appropriate. Okay, so an example might be having Indigenous culture, like culturally appropriate health services for Indigenous communities so that they're more likely to access those health services and, seek treatment when they need instead of putting it off to the very last minute. Another example might be to ensure that people are getting are able to actually pay for those things in the first place, right? So things like Medicare and PBS, they really ensure that things are affordable and accessible for everyday people to access healthcare. Reducing social inequalities. Okay, so there are loads of inequities that exist in our society, and that is reflected in the way people can access healthcare. These include gender, socioeconomic status, race, age, physical environment, and geographic location. Okay, so reducing social inequalities might be something like, hey, on this day we're gonna have for men a little service to a little meeting to enable men in the area to talk about mental health issues. Okay, so that they're able to overcome the limitations of masculinity and addressing mental health and this macho image that is leading to less and less men seeking help when they need to and leading into higher suicide rates. The other thing is empowers individuals and communities. Okay, so that's another principle, and it's all about providing knowledge to empower individuals, and it's all about education. Okay, so once an individual, so for example, you might start learning about reduce, reuse, recycle at school in primary school, and then when you go home, you might see a milk carton at home and you'll be like, hey, I should recycle this, and you pass on that education to your family, to your other household members. So that is what basically about when you empower the individual, you empower the community, right? Because there's a village behind the individual. The other thing is addresses broader determinants of health. In our society, social, environmental, and economic factors impact on health. And that's just, that sort of idea only recently came about, whereas in the 1900s, it was less so. It was sort of just like, if you died, you died, but like, it's less of a focus on, hey, this could have been prevented by ensuring that people who are poorer get access to better health literacy to understand the risks of this behavior. Whereas now it's really focused on like ensuring that, hey, there are loads of things outside a person's control influencing their decisions, and we need to address those so that people can make the best decisions possible for their health. So these sort of broader determinants include things like gender, income, culture, basically all of these factors. All right. One thing I want you to note, by the way, is socioeconomic status includes your education level, your employment, and also your income level. Okay, so it's really encompassing a bunch of things, so please be aware of that when you're discussing it. The last principle is intersectoral collaboration. where the public and the private sector are working together in a coordinated action to improve health outcomes for all. So it ensures things like your charities, like your St. Vinny's and Salvos, are working with the local council and federal government to provide the best, most well-resourced, well-informed pro-health initiative for their community. Okay, so if the council was working on their own, even though they might know exactly what the community needs, they might not have all the funding and the resources. Whereas the federal government, even though they might have all the funding and the resources, they might not know exactly what the specific ways to implement it in that community is. And then, of course, if it's like Salvos, they might have that specific knowledge or world vision. They might know how to tackle that specific issue in that community. All right, so when the public and private sector work together, it creates much, much more informed and coordinated health promotion programs that are actually effective. Alrighty. So, strengths and weaknesses of the social model. So it's really important that you know this. Like I said, for biomedical, you need to know it for social. I'll just touch on a couple here. One is that it focuses on the prevention of disease. The biomedical model doesn't, and that's kind of a problem because it means that, you're not actually treating the root cause of the problem. And it also means that the social model is a lot cheaper because when you're preventing, it's a lot cheaper than when you're using medical technology, you're creating medications, you're using the X-ray machine. That's way more expensive than if you're just, creating an education program or creating a law. So yeah. The weaknesses are not all diseases can actually be prevented, as many conditions, such as genetic conditions, still need medical research on how to prevent it. And of course, individuals can just choose to ignore the health promotion messages. I'm sure many of us have done it before, hey, make sure you drink lots of water, make sure you make sure you eat well, eat lots of fruits and veggies. It's very easy to ignore those. So it can't always be effective, although generally it actually has improved health and well-being over time. Alright, so again, really important table to refer to. Alrighty, so let's do a practice question, and this is from last year's exam. And it's combining both the biomedical and the social models of health and sort of bringing about improvements in health status. And like I said before, when you see a case study, make sure you're not just reading that and then trying to answer the question, then trying to read the question. You read the question first. So here it says, with reference to one success, analyze the relationship. Okay, so you just need to pick one of these here. And that means you wouldn't have to read this first line. So, one success might be deaths from tuberculosis have been eliminated. And then because it's 6 marks, you split it into sort of essentially 3 and 3. 3 for biomedical and 3 for social. So the first mark, I would say, is to define the biomedical model of health, right? It's about diagnosis, treatment, and cure, focusing on the physical and biological aspects. Whereas the social model is all about health promotion. It's all about addressing the broader determinants of health. And then you sort of refer to the guiding principles. The 5 principles encapsulated in the AREAS acronym. Okay, so here's a sample answer provided from a high scoring response. As you can see here, the average was 2.7 out of 6. So common mistakes were that they didn't link to a health status indicator, and sort of neglected to how discussing the two models and their contribution to the improvement of health and well-being. Okay, so the biomedical model is an approach to health that focuses on the physical and biological aspects. So that's what I'm saying. You first define what the actual model is. And then you say for TB, this has involved the development of vaccines and antibiotics, right? Because it's all about the development of medical technology and treatments. And that reduced the effects of TB in Australia. Okay, so the biomedical model is all about treating using medical knowledge, and TB is a bacterial infection. Okay, so it's important that you know that TB is a bacterial infection, meaning antibiotics can treat it and reduce the number of deaths from TB in Australia. This has ultimately led to the success of eliminating all deaths. Okay, and hence achieved a reduced mortality from TB in Australia. Okay, so this might be a bit repetitive, but it's really good in that it creates a really succinct answer that answers the question. Then the second paragraph, so I would actually create another paragraph here, just so it's not just one huge chunk of text. The social model of health, on the other hand, focuses on the broader determinants of health, and it aims to provide education and health promotion to focus on disease prevention. Okay, so this might be about like teaching hygiene practices in school. So all throughout COVID, we were taught to wear a mask, wash our hands, standard social distance. Those are really important education those are personal skills that we were educated about. And that is under the social model of health promotion campaigns. So when you wash your hands at the bathroom, you'll see something that says run under hot water for 5 seconds with soap, right? And that's something now we know, thanks to the incredible amounts of education and pushes from health organizations to educate the mass population. Okay, and this was to stop the transmission of TB bacteria into the air to infect others. So the main thing that you need to say though at the end, because the question is analyze the relationship between these two models, you need to say this one line that I said. Therefore, together with the biomedical model of health, the social model of health also works to contribute to the overall reduction, blah, blah, blah. Basically what you're saying is the biomedical and the social models of health must work together in order to reduce and effectively reduce the incidence and mortality of TB. Okay, and this goes with literally all the questions about analyzing the relationship, strengths and limitations, and then also, hey, look, we can't have one without the other. They need to work together. Okay, so that one line is really important, but also the way you structure it. So this is like a really good answer, probably getting 6 marks. The only thing being the paragraphing, and this sentence could be a bit more succinct. The next part of that dot point, the first dot point, is the Ottawa Charter for Health Promotion. So you might have already heard about this, but basically it was developed under the first International Conference for Health Promotion, I believe. And it's basically an approach to health developed by the WHO. Okay, and it's developed from the social model of health, and it defines health promotion as the process of enabling people to increase control over and to improve their health. Okay, and strategies for health promotion are mediating, advocating, and enabling. And these three, you don't really need to know it because it's not generally assessed anymore in VCAR exams as it was in the previous study design, but many schools like to ask these questions perhaps, so definitely knowing these definitions is really important. And there are some really good mnemonics to remember the action areas of the Ottawa Charter, which I'll go over in the next page. Boys can swim down rivers, or bad cats smell dead rats. Okay, so again, it's really easy to get the Ottawa Charter areas and the principles of social model of health confused. So having mnemonics and acronyms to remember them is really important, so you're not mucking them up. Okay. So I have another table here for you to really condense all of this information into one page. So build healthy public policy is basically about the government making rules and legislations to ensure that people are able to make the best decision possible. All right, so alcohol marketing, things like that. There's lots of laws limiting alcohol marketing, especially after school times when kids are at home, because you don't want kids to be influenced to think, hey, drinking is a cool thing, especially like 10-year-old kids, which is why right now the rates of drinking have decreased due to all of these laws and everything about marketing alcohol and promoting alcohol and selling alcohol. It's reduced the overall level of drinking and deaths from drinking. Creating supportive environments, it's about changing the physical environment, right? And also sort of creating social environments to talk about health issues or support each other. So one example is ensuring children's playgrounds are free from hazards, but another one might be that a mental health, like I said, a gathering for Indigenous individuals or trans individuals or men to talk about mental health issues or societal issues or health issues that they're facing and gain like the appropriate information they need in a supportive environment. The third action area is strengthen community action. Okay, so this is about bringing everyone together so that they're working towards one common health goal or a couple of common health goals. So this might be to reduce the incidence of this specific communicable disease in our community right now, where everyone's working together, for example, to reduce the spread of COVID. Okay, and this is done through things like your marketing and advertising and things like that, and also just general education. So even in our schools and everything, we were really being taught to ensure that we were complying with the COVID restrictions and things like that. And that was one way we were all strengthening our community action so that we're all fighting to ensure that the spread of COVID was reduced. Okay, so it's really important when you see these abstract concepts, you're linking it to your everyday life so that you're able to really understand what it means to like, because strength and community action can seem pretty broad, right? But once you start learning, hey, it's all about everyone working towards a common goal. Oh wait, we did that for the past couple of years now. It can make it a bit more easier to remember. Now, develop personal skills, I always like to link it to cooking classes, okay? That's obviously not the only answer, but basically it's about education, okay? So you're giving people skills to be in a better position to make choices and decisions about their health. So one example might be cooking classes where you're being taught to create nutritionally appropriate and also like just generally cost-effective foods that are culturally appropriate. So you might be learning how to make vegetarian foods and halal foods. And by developing those personal skills, you're making it easier for people to, instead of buying takeout, to make a healthy meal at home for dinner, right? So developing personal skills is really important because you can educate people about eating healthy, but unless they don't know how, like if they don't know how to make a healthy meal, then there's no point in telling people to. So you need to make sure that they actually have that tool set to do what they're being told to do for their own health. And the last action area is reorienting health services. So this one confused me for a bit, actually throughout year 12, but eventually I understood what it means. It basically is about, instead of doctors being like, hey, look, you're coming in here, you're feeling sick, all right, here's a medication, you know, with the little snake handwriting that you can't really understand what they're saying. Okay, go and get this medication. And then a couple of weeks later, they come back again being like, hey, look, I feel sick again. They prescribe another medication. Instead, the doctor would be like, look, have you been smoking? Is that the reason why you're presenting with this like repeated lung issue? Okay, let me explain to you. These are the benefits of stopping smoking, okay? And then the doctor can really personally discuss with the patient, look, these are my experiences, like, it might be like, I used to be a smoker, or like, my dad used to be a smoker, and then really like sort of appeal to this patient at a really personal level to educate them. And in many cases, this might be a lot more effective than just one like health promotion program saying, hey, quit smoking, because you're really making sure that a doctor who has medical experience and expertise and sort of sense of status is able to educate everyday people to make better, healthier choices so that they're not really becoming as reliant on medical professionals and services and instead are able to make better choices themselves. Right? And like I said, it's based on the social model. So what you're trying to do with all of these action areas is to prevent disease. Okay? You're not trying to treat disease, you're trying to prevent disease. So if you start talking about like using x-rays and chemotherapy or whatever in reorient health services, it's sort of missing the point, because it's not about the biomedical model, it's about the social model and preventing those illnesses and diseases happening in the first place. So I hope that makes sense. It's basically all related to the social model of health. Boys can swim down rivers, or bad cats smell dead rats. So this is sort of how I imagine building healthy public policy. This is about sort of creating supportive environments, strengthening community action, and developing personal skills, reorienting health services. Like, you should definitely remember these and definitely know some examples of these so that you can really effectively answer these questions. You will have to link the Ottawa Charter action areas to quite a few of the dot points in Unit 3 of Study 2. So, if anything, if you remember anything from today, just to at least remember this, it's kind of important. Okay, so let's do it, since I said it's so important, let's do a practice question together. Okay, so this is from the 2021 exam, VCE exam, and as you can see, it's a 6-mark question, and there's a 1-line and then a 2-line question. So I'd probably not bother with skipping the case study, it probably is very important. So, the harmful use of alcohol is one of the leading risk factors for population health worldwide. Discuss 2 action areas of the Ottawa Charter for Health Promotion that could be used to address increased rates of alcohol consumption. Okay, so what are some risk factors from Unit 3 of Study 1 that we know about alcohol consumption? Right, you need to know that having low levels of health literacy might make you be less prone to understand the risks of alcohol consumption, laws about regulating alcohol consumption. You need to know all of these things related to our community and why people might go and turn to alcohol consumption, especially excessive alcohol consumption. You must discuss 2 action areas, and as you can see, it's 6 marks, right? So immediately I would go 6 divided by 2, 3 marks each. So 3 and 3 paragraphs. So 2 paragraphs that are worth 3 marks each. And you must relate it to 2. So build healthy public policy in terms of the action areas of the Ottawa Charter. And in terms of addressing the rates of alcohol consumption, you might say, hey, maybe increase the price of alcohol to ensure, or increase taxes on alcohol so that people are less likely to buy it due to being less likely to afford it, and thus reduce the overall rates of alcohol consumption. Another one might be create supportive environments. Okay, so maybe a support group for people who are struggling with alcohol consumption, like an alcohol addiction group, like Alcoholics Anonymous. That might be there to help people surround themselves with people that also want to quit alcohol, become sober. That might make them less likely to continue to consume alcohol because they're held accountable by their group, right? And they're really supported and on track and accountable by this group of people in this supportive environment. Okay, so really underline the supportive environment aspect. Another action area that could be used to address it is strengthen community action. So everyone's working together towards the same goal. That might be through your marketing and things like that, constantly educating people. Develop personal skills is also about education, right? So you might say one action area that can be used is develop personal skills, and this is by educating individuals on the risks of excessive alcohol consumption, such as increased risk of liver cirrhosis and increased risk of death. And then educate them on ways to become sober and support services in the community available for them, so that if they want to quit, become sober, they have the resources and the knowledge to know how to do it. Reorient health services. So like I said about that sort of example of a man going and getting medications and then realizing, hey, look, you should probably stop smoking to prevent this happening, the doctor will take the role of the educator. So in this case, the doctor would take the role of the educator again and say, probably discuss with their patients the dangers of alcohol consumption, because that might make it more understand the risk and be less likely to drink alcohol. Alrighty. So here is a sample answer, and as you can see, it's split into 2 paragraphs and they're worth 3 marks each, and the average marks was 3.3, so it's not too bad. It's actually pretty good, so most people got half the marks. But to get that full marks, here's what you should do. Number 1, you should really provide the example and then say how it can decrease overall alcohol consumption. So like I said, conscious buyers would be less likely to buy alcohol that is too expensive, and then this can decrease overall alcohol consumption. Then for creative supportive environments, those suffering alcohol addiction can access helplines and websites online where others who are experienced or are currently experiencing alcohol addiction share their stories and advice, right? So it's providing like a really visual depiction of how they can create a supportive environment, and then decreasing alcohol consumption compared to those who are inspired and want to stop. Okay? And then they provide 2 examples for each, right? So they also say laws on how many drinks are allowed to be bought from a bar from a single customer. The other is school or work events are ensured that the drinks provided are not alcoholic. So all of these 4 strategies, one about taxing, the other one about bar, the other one about school and work events, and the other one about helplines, all would decrease the rates of alcohol consumption. Okay? Alrighty, so now we are moving on to Australia's health system, okay? So Medicare, NDIS, PBS, and private health insurance. So, it really isn't necessary that when we're discussing these 4 health system pillars, that you link it to the following. This acronym called SAFE, sustainability. So that's about ensuring that the health needs are met currently and into the future. So this is this WHO definition of, it's about resources being available for now and for future generations. That's a WHO definition. Access is all about the health system is accessible for all people. Funding is about the financial resources and how the actual service is funded and how it's used. And equity is all about emphasizing extra support for disadvantaged people. Okay? So equal access doesn't mean it's equitable, right? So disadvantaged, if people are having this level of access and disadvantaged people are here, and they both receive the same level of treatment, that's not equity. But if it's this person is providing that, getting the adequate level of support, whereas this disadvantaged person is not, equity is about ensuring this person does reach that same level playing field. So, what is Medicare? A lot of you might know this definition from 1-2 HHD. It's a national health scheme providing free or subsidized access to necessary medical services to all Australians and people from countries with reciprocal agreements. Okay, so it covers anything at all that is clinically necessary and has a safety net to prevent large overall costs for the individuals. So one example is doctor's consultations, X-ray and pathology tests, eye tests by the optometrist, surgeries in public hospitals, okay? So those are things that are covered by Medicare. And the main one would be doctors' GP consultations. But things that it does not cover are things like home nursing treatment, alternative services, so things like acupuncture or physiotherapy or chiropractor or podiatrist or whatever. Cosmetic surgery, because, it's not clinically necessary or medically necessary. And ambulance services, you'll have to actually take out your own ambulance membership. And another thing it doesn't cover is dentists. Okay? And Medicare is funded in 3 ways. The Medicare levy, which is 2% of an taxable income for those who earn above the taxable threshold. The Medicare levy surcharge. So this is an extra 1 to 1.5% of taxable income for high income earners without private health insurance. All right, so this will come back again. General taxation. All right, that's the 3rd way. So it's just these 2 combined is just not enough to fund Medicare. Medicare is pretty expensive to fund, so they also take out money from general tax collected overall. Okay, and you do need to know strengths and weaknesses of Medicare. So one thing is that it's available to all Australian citizens, but there is a wait list for many treatments. And it covers the cost for essential medical services, but it often does not cover full amount of doctor's visits, only the schedule fee. So if the doctor charges extra or you go somewhere that's a bit more expensive, you will have to pay some out-of-pocket expenses. And yeah, the waiting list is really important for things like elective surgeries in public hospitals, because lots of people sometimes will have to wait like 2 years just to get that surgery. So they often try to turn to private hospitals, which I'll explain a bit more about. And then of course the Medicare safety net is a huge strength, because meaning that, hey look, if a person keeps, like someone who regularly needs to access medical services due to having a chronic illness or something, every time they go to the doctor, they're not being well, if they have to pay something extra, every single time they're not paying extra, right? Because once they reach that safety net, they're being covered. They're being subsidized further, or it's just completely free from then on for that calendar year. And you need to link it to SAFE, right? Sustainability. Medicare is sustainable. Medicare demonstrates sustainability because it only covers services that are deemed absolutely necessary, right? So this enables it to continue to run for future generations so that future generations can also access Medicare. The other thing is access. Medicare reduces the cost of medically necessary services and thus demonstrates access because everyone is able to access these services regardless of their ability to pay. And the other thing is Medicare is automatically available to all Australians. You don't have to do like really complex paperwork to access Medicare. Everyone just gets it. Whereas things like NDIS, the National Disability Insurance Scheme, you have to like go through all this complex paperwork just to access it. Whereas this, it's available for everyone. Funding. So first you'd say the 3 ways that it's funded, and then you'd say Medicare demonstrates funding through these. It's funded through these ways. And then this is used to fund medically necessary health services. In public hospitals, it's fee-free, so it's free. And in other consultations, it would be subsidized. And equity. So Medicare safety net enables that disadvantaged people have extra protection from high out-of-pocket expenses, right? So instead of them always having to pay their out-of-pocket expenses, once they reach that certain threshold for that calendar year, they no longer have to pay, or they're having like really subsidized costs, so they're not paying too much. That demonstrates equity because you're making sure that disadvantaged people, so poorer people, are protected from high out-of-pocket costs and are on a level playing field with the higher income earners. Alright, so now for private health insurance. This definition is really important. It's an optional health insurance service where members pay a premium in return for services not covered by Medicare. Okay, so this is additional, it's optional, and there is an additional cost in the form of a premium, right? So that premium plus if you're choosing any extras, you'll have to pay even more. Some examples of private health insurance providers include Bupa, Medibank, AH&M, HCF, NIB, etc. You've probably seen many of those ads, right? So these are all private health insurance providers where it's optional and you'll have to pay extra. So some services that it covers include physiotherapy, dental services, maternity, etc. So some of these come automatically depending on the plan you choose and the provider you choose, and others you have to add on and pay even more than the premium. By the way, please try not to use PHI as it's not an official acronym. It's just something that's used as shorthand to ensure that, you know, the slides are as concise as possible. All right, so that's just an FYI. So what are the incentives to take out private health insurance? So there are 3 main incentives in place. There's lifetime health cover, which basically means when taking out PHI, those who are aged over 30 pay an extra 2% on their premiums for every year they are over 30 and take out the policy. Okay, so there's a maximum loading of 70%, and it basically targets young Australians to take out health insurance earlier, right? Because they won't have to pay extra if they take it out before they're 30. The private health insurance rebate is another one, which basically means when you're paying those premiums, you'll get some money back depending on your income and things like that. And basically targets low and middle income earners to ensure that, you know, they'll be like, hey, look, I'll get money back if I pay for private health insurance, so might as well. The other thing is Medicare levy surcharge. Okay, so this is sort of like a negative. So this is all about positive things, this is about negative things. So basically, if you don't take out private health insurance, you're kind of punished if you're a high income earner. So those who earn over a set amount, so like higher income, but they don't have private health insurance, they need to pay an extra 1 to 1.5%. And that's one of the ways Medicare is funded, right? So it basically means that, hey, I should probably take out private health insurance and reduce the burden on Medicare so that I don't have to pay an extra 1 to 1.5%. Some strengths of private health insurance include choice of doctor while you're in a public or a private hospital, but it is really costly for the individual because you will have to pay premiums, and sometimes you have to cover those extras. You'll have to pay even more than that on top. And then sometimes you have to pay the gap as well. But sometimes there are shorter waiting times for some medical procedures, like for elective surgery. But, it all depends on, look, is the shorter waiting time a benefit or a weakness because I have to pay this much? And doctors can charge more than the scheduled fee. And some of that might be charged by the insurer, but the rest might have to be paid by the individual. And a really good strength of PHI, though, even though it might not be the benefit for the individual, but for society, is that it reduces the burden on the public health system. Okay, because when you have private health insurance, you're more likely to go to a private hospital and afford it, reducing the burden on the public health system and public health hospitals. Okay, so we have a case study here from VCAD 2021 exam, and the key thing I want you to remember is you don't need to read the case study unless you find that, hey, the question refers to it. In this case, you don't. So I put that case study in there to help you realize that, look, you need to read the question first, because in this one, all it says is list one service covered by Medicare and one service covered through private health insurance. Okay, that could be. So for Medicare, you might say GP consultations, specialist consultations, public hospital stays. Whereas private health insurance, you might say physiotherapy or chiropractor, because that is health services that could be accessed through private health insurance. So yeah, you really need to know what services are covered and what services are not, so you can properly answer these questions. Okay? Private health insurance, again, you need to link it to SAFE. Okay, so that's sustainability. There's less burden on the public health system, meaning that future generations can also access it. Other than that, sustainability is also demonstrated by the private health insurance, as it's economically sustainable, helping meet the current generation's needs as well. In terms of access, through incentives like the rebate scheme and the lifetime, through the rebate scheme, the government tries to make it more financially accessible, right? Because the rebate scheme ensures that people are getting their money back if they're paying those premiums. Funding, it is funded through members paying extra premiums, so it's out of pocket, and it's used to cover health services that are not covered by Medicare, right? And then you would provide examples. So, for example, one might be physiotherapy, another one might be dental services, and that can improve health status by reducing morbidity, such as back pain through physiotherapy or dental pain, like your toothache. For equity, the rebate scheme provides greater rebate for lower income earners. So it means that disadvantaged individuals are getting more protection from higher out-of-pocket expenses by getting more money back than the other higher income earners. Alrighty, so now on to the Pharmaceutical Benefit Scheme, also known as PBS. And it's a federal government scheme providing subsidised access to essential medications to all Australians regardless of their ability to pay. So it aims to make essential medicines available through subsidising a bunch of prescription medications at affordable prices, right? So right now, if you wanted to access a PBS listed medicine, so medicines that are deemed medically necessary, so you can search it up, the maximum amount of money they'll have to pay out of pocket is $30, right? So some of these medications might actually cost like thousands of dollars, but the maximum that you'll have to pay is $30. The rest is covered by the government through the PBS, okay? And like I said, medications that are on it are PBS listed medications, and you can search these up on the PBS website. This is available for Australians and those who are from a country with a reciprocal agreement, so like Belgium, the UK, New Zealand, and it has a safety net to prevent large costs for individuals. Okay, so the PBS safety net ensures that once people have reached the maximum threshold for that calendar year, they no longer have to pay, or they'll have to pay like $7.30 per medication instead of $30, or they'll have to pay $0 instead of $7.30. Okay, so these safety nets are there to ensure that disadvantaged people are not constantly having to pay $30 every time they buy medication. So for example, if you need a medication every 2 weeks, right, it only lasts 2 weeks, and you're paying $30 every 2 weeks, that would be like 30 times 26. I don't know how much that is, but it would be like above $1,000. And if you're like a really low income earner and you have a lot of other costs, like, you know, you have kids you need to send to school, you need to put food on the table, it can really, really create a huge financial burden. So this safety net is there to prevent large costs. Okay? So you need to know the strengths and weaknesses of all of these, like I said. So some strengths are the PBS safety net protects people from the high cost of medication. There's access to essential medication at a subsidized rate and sometimes no cost. The thing that I really want you to avoid is saying that PBS makes things free, right? Because unless you're a concession card holding Indigenous individual, the medications are not free, they are just subsidized. So they're not as expensive as they originally are. It's like a discount. So please don't, in your definition, say PBS provides free medications. It doesn't, it's subsidized medications. And again, the last dot point of strengths, it provides additional support to those with concession cards by having lower co-payments. Okay, so people who have concession cards only have to pay like $7.30 per medication instead of $30. Okay, and if you're Indigenous, and you'll also have to only pay $7.30, and if you're Indigenous and hold a concession card, you'll have to pay only nothing. So yeah. It's all about closing the gap and making sure that the most vulnerable population groups have the greater access to PBS medications. Weaknesses of the PBS, it costs billions of dollars, and this is a huge financial burden on the federal government. And it doesn't cover all medications, only those that are on the PBS list. And for most Australians, there still is a $30 co-payment per prescription. Right? So even though that's better than thousands of dollars, that's still a lot. It's not free, it's subsidized. So that's one weakness. Although generally, the PBS has enabled Australia to have like less cases of like, I couldn't afford this medication, so I just, you know, had to deal with it in other ways, or just had to manage my condition, or sometimes die because I couldn't access that life-saving medication. So that happens in many other countries that don't have these sort of health schemes. But Australia does. There are things that can be improved about it, but generally it is life-saving. So, sustainability. PBS demonstrates sustainability because it only adds medications that are actually deemed effective and life-saving. Only the most necessary medications are added and subsidized so that the economic sustainability can happen, so that future generations can also access those medications, right? Because if the government went all out and was just like, for both PBS and Medicare, was just like, hey, look, we're just going to cover everything that you need, we're going to be literally trillions and trillions of dollars in debt, right? We don't want that to happen. So this is why medications are done in a way that is sustainable, so that only medications that are most necessary are added. Access. It's automatically available for Australians. Again, there's no messy paperwork. So for private health insurance, you might have to do a bit more. But for PBS and Medicare, you don't have to. It's just automatically available. Unless you're not from Australia. And basically, it reduces out-of-pocket expenses for each medication as it's subsidized. Funding. How is the PBS funded? It's funded by general taxation. So whilst Medicare is done through, like, there's an extra tax called the Medicare levy and the surcharge, PBS has nothing called like a PBS surcharge. It's just the general taxation that covers all of these, right? So it's literally costing billions and billions of dollars each year. And And this general taxation funds the subsidies so that patients only pay up to $30, right? So you'll either be paying like 0, $7.30 or like 30 max. Equity is demonstrated through the PBS through the safety net. The PBS safety net basically means once customers or consumers reach a certain threshold, they will have to pay a lower amount or like a further subsidized amount or nothing at all. And this protects households from incurring overall way larger expenses, right? So you want to ensure that poorer families are not having to pay like $30 per day or per week or whatever it is. So once they reach like a couple of $1,000s, from then on, they just have to pay a little bit per medication or nothing at all. Alrighty. So, question from 2019, and it's 4 marks. Okay, so the task word in this question is analyze, so you have to provide a bit more detail, and it's in relation to the PBS and sustainability and equity. The thing that you need to do is split this into 2 parts. So 4 marks means 2 and 2, so the 2 paragraphs are 2 marks. The first would be how it demonstrates sustainability, right? So how does the PBS demonstrate sustainability? If you have a look here, it only adds medications that are deemed effective and most necessary, so that future generations can also access PBS medication. And then you also insert the words economic sustainability somewhere there, so as long as you're linking to this idea of future generations also need to be able to access PBS. So here is a sample answer. So PBS demonstrates sustainability because not every medication is listed on the PBS. This helps to keep the costs under control and allows for new medications to be listed in the future without having to take the old ones off. The PBS also demonstrates equity because the PBS safety net ensures that once individuals or families reach a certain threshold in one calendar year, they will have to pay it at a reduced cost or nothing at all, so that they are protected from large overall expenses. And then the key thing you need to underscore when you're saying equity is it helps those who need it the most, or helps the most disadvantaged. So yeah, really, this is a really high scoring response because not only is it really really focused in integrating the definitions of sustainability and equity, it's really good at being concise, right? So this is one sentence and this is one really long sentence that could be sort of broken up into 2, but yeah, so it's succinct, but it also gets all the marks. One thing you can see is 40% got 0, right? So it's really easy to lose marks, but I suppose as long as you write something, you'll at least get that mark, you know? So as long as you know roughly that sustainability means future generations can also access it, only the things that are necessary are covered, and that equity is about disadvantaged people getting more, you will be fine. The National Disability Insurance Scheme, right? So this is the NDIS, and basically this provides support services for individuals and families of individuals with permanent significant disabilities. Okay, so what does that mean? There's like a definition, you can go look it up, but that's the definition that you need to know. And it's done through an individualized plan, right? So each patient under the NDIS gets an individualized plan to assist them to live an ordinary life. It's funded by the Medicare levy. So if you need to know funding, it's funded by the Medicare levy. And there are individualized packages and various levels of support. So to access these support services, you need to be under 65, you need to have a lifelong and permanent disability, so it's not something temporary. And basically it helps individuals to access mainstream community services, maintain informal support arrangements, so in terms of like having like family member take care of them so that, you know, there's less burden on the public health system, or like, you know, having carers, because carers are very like limited and there's huge demand for them. So the NDIS tries to maintain informal support arrangements as much as they can. And also helps individuals to receive reasonable necessary funding. So for example, public housing and assistive technology like your wheelchairs and things like that, or like mobility scooters, and also transport to community service. So if, for example, someone wanted to go to like a movie club or like a book club or something, you could transport them to and from there if the individualized plan says that they are eligible for that level of care. Okay, so the NDIA runs all of this. So yeah, if you want to learn more about it, I recommend checking it out. And that's the NDIS logo. So again, anything related to the pillars of health, those NDIS, private health insurance, PBS, and Medicare, you need to link to SAFE when the question asks you. So, in terms of sustainability, there is individualized plans, right? So people are not receiving more funding than is necessary. They're not receiving more support than is necessary to ensure that future generations can also access the NDIS, right? Because if, like I said, if the government just kept on paying for everything, then there would be nothing left in the future, right? So sustainability is important so that only what is necessary is covered and paid for. In terms of access, it's available to these people who meet this criteria: under 65, permanent significant disabilities. And they can access a range of services so that they can live an ordinary life. In terms of funding, the funding is shared amongst all levels of government, and it's funded by the Medicare levy, and it funds all of these incredibly important equipment and transportation and just general things for people to live an ordinary life. Sometimes it even funds like public housing, so that they're not living on the street. So yeah, it's a really important service for like many disabled individuals in our community. Equity. So through an individualized plan, there is more support provided to those who need it the most. Okay, so it means that disadvantaged people are receiving a higher level of care than those who are more comparatively advantaged. So this came up in a range of VCAR practice exams. The one I've picked is the 2022 exam question. And basically asks, describe how the NDIS promotes health and well-being in terms of both equity and access. So you have health and well-being, equity, access, and it's 4 marks. Okay, so when you see those 4 marks, the first thing you should think is 2 paragraphs, 2 marks each, 1 for equity, 1 for access. Okay, and the next thing that comes into your head should be these dot points, right? So equity, it's about individualized plan. Those who need more support will have more support. And then for access, we'll say it's available to these people and they can access these health services to live an ordinary life. Okay? And then you need to say, and then you need to just link it to how it promotes health and well-being. So that's the general way you should structure these answers. So here is a sample answer. Again, the average was 1.4, which is better than 0.4, but to achieve full marks, you really need to make a meaningful link to a dimension of health and well-being. Okay, so the thing with health and well-being, anytime you see those 2 words, you have to link it to a dimension. So if you don't link it to a dimension, you lose the marks. And then saying things like the NDIS can provide resources, yes, that defines what the NDIS does, but it's not linking it to equity and access, which is what you need to do to answer this question. Okay, so again, you split it off into 2 paragraphs. The first one saying the NDIS provides appropriate amounts of funding to individuals based on the severity of their disability. Okay, so the more support they need, the more funding is put towards carers or wheelchairs. And then they link it to a dimension. So the second mark. This can promote their spiritual health and well-being, as they may feel a deeper sense of belonging by knowing that their needs are being considered. Okay, a deeper sense of belonging to the community because the government is literally like ensuring that their needs are being considered. In terms of access, like I said, individuals with disabilities are able to live a higher quality life because they can access education, employment, and participate in community activities and events. Okay, so this can promote their social health and well-being. I highly recommend don't do this just because it's not a good habit. Make sure you actually fully write health and well-being. But yeah, because socializing with people at school and the community can enhance their ability to develop communication skills and a strong support network. Okay, so really important that you read the question because it's combining both Unit 3 of Study 1, Health and Wellbeing Dimensions, and Unit 3 of Study 2, Equity and Access, with the NDIS. Alrighty. So, that was basically, we've covered the Australia's health system, so we've covered the first couple of dot points. Now we're moving on to this idea of health promotion and initiatives. So the first dot point says that you need to pick one of the health issues in Australia and then pick an initiative that addresses one of these issues. So, like, you can pick either road safety, skin cancer, or smoking, and for this lecture, I've picked smoking. Okay, so the first thing you need to know is why smoking is targeted, or why is skin cancer targeted, why is road safety targeted. It's basically like statistics. So one reason is that smoking kills around 15,000 Australians each year, and it affects vulnerable population groups disproportionately, and affects, like these vulnerable population groups. And in terms of the effectiveness of health promotion, there has been a delay in the uptake of smoking, right? So basically from like the 80s onwards, there's been huge campaigns to ensure that smoking rates are reduced. And it's been effective. There are less people smoking now. Fewer people are being exposed to secondhand tobacco smoke. It decreased from, in 1995, 31% of children were exposed to it, whereas in 2013, only 3.7%. And if you didn't know, secondhand tobacco smoke is when someone else is smoking and then you breathe it in. Okay? The prevalence of daily smokers aged over 12 has decreased from 24% to 12%. This is really significant. It means that these health promotion campaigns are actually effective, right? Even though it might seem like kind of silly, like how can ads and things like that actually change? But what we don't realize is media has a huge impact on how we make our decisions and everything. So the government has been using it to its advantage to ensure that health promotion is achieved and rates of smoking are decreased so that life expectancy increases. Alrighty. Now, you need to know one specific health promotion program that is used to address this specific health issue. So I picked Quitline. That's basically a telephone service that people can access for strategies on how to quit. And it's staffed by highly trained specialists, and there is an Aboriginal Quitline available for Indigenous people. The Quitline provides callers with a personalised plan to quit, so it's really individualised because it's just one-on-one. And it's only the cost of a phone call, or if you're referred to by a health professional, it's completely free. So not only that, it's available to all Australians, regardless of your socioeconomic status, right? So it's really accessible. It's really ensuring that the personal skills are developed in terms of knowing how to quit, knowing where to access information, knowing how to access support groups on how to quit from highly trained specialists. And it's ensuring that there's huge focus on preventing smoking instead of treating diseases caused by smoking. Okay? So Quit Victoria. So you need to ensure that you actually can explain how this program reflects the Ottawa Charter for Health Promotion action areas. Okay? So if you remember the acronym, it is Boys Can Swim Down Rivers, or Bad Cats Smell Dead Rats. Okay, so build healthy public policy for B. It has pushed for smoke-free outdoor areas so that there's more regulations limiting smoking. For C, create supportive environments. There's Quitline, Quit Coach, and Quit Text. And they're all online platforms to assist smokers to quit, right? And the fact that there are a range of online platforms for this ensures that there is really lower levels of there's really low levels of resistance in terms of quitting smoking. It's really easy, less friction. Strengthens community action. There are online resources available specifically for friends and families of smokers. So it's not just it's not the onus of just the smoker. Friends and family can also assist the smoker to quit. So they're all working towards one common shared health goal. Develop personal skills. So when you're providing practical advice and strategies on quitting, you're actually giving them personal skills to make decisions about their own health to improve their health and well-being, right? And it also reorients health services. A specialist training is provided to health professionals so that they can undertake interventions and referrals to Quitline, right? So if they see one of their patients is like really struggling to quit and they want to also quit, they can actually refer them to Quitline, right? The doctors can. So they're taking on this role of the educator, and yeah, ensuring that there's less resistance to quitting as health professionals are also being involved in quitting. Alrighty, time for another practice question. So VCA 2019. So you're selecting a target area, so it's a health issue for health promotion. Okay, so I probably would pick smoking because that's the one we've covered. And then you say, explain why health promotion was used to target this area. Alright, so when you're saying that, basically what we're saying is, hey, smoking actually led to many of these communicable and non-communicable diseases due to weakened immune function. It killed 15,000 smokers per year. So you're using data and you're saying, hey, smoking has been shown to cause this disease. Right? So you're saying why smoking was really harming our population. That is why it's targeted. Same thing for skin cancer and same thing for road safety. You would say there were this many deaths happening on the roads each year, or this many people were dying from skin cancer. So yeah. So in this answer, what they said is skin cancer. And they said Australia has the highest rate of skin cancer in the world. Many cases of skin cancer are preventable by changing behavior such as the use of sunscreen, right? So they didn't have any data or anything, any complex data that they had to memorize. They just said this is the reason. Australia has the highest rate, right? So no numbers, and many cases are preventable. Okay, same with smoking. Many smoking-related illnesses are preventable. So you could also use that to explain why health promotion was used to target this area. Alrighty. Now, we are going to be moving on to initiatives for Indigenous health and wellbeing. There are two types of questions related to Indigenous health and wellbeing in this course, so specifically in Unit 3 of Study 2. So number one, you have to evaluate information from a case study in terms of how effective that initiative is in addressing and improving Indigenous health and wellbeing. Number two is you have to have your own knowledge of an initiative and then link it to the Ottawa Charter for Health Promotion action areas. Okay, so for both the previous dot point and this one, you need to know your own initiative for either smoking, road safety, or skin cancer. And then for this one, you need to know an initiative for Indigenous health and wellbeing. So make sure you have one ready to go and you know how to link it to the Ottawa Charter for Health Promotion for both of them. Alright, so first let's do the first one. Okay, so you can see that you're going to have a long case study and you have to be able to evaluate the initiative. So this was assessed last year in the exam, so VCA 2022, and it's a 6-mark question. Alright, there's a couple of things that I want you to take in here. 6 marks means, and 6 marks and 2 action areas means 2 paragraphs of 3 marks each. Okay, and you have to describe how those action areas are evident in the campaign. Okay, and you need to identify and describe and explain. So it might seem like a lot, but when you split it up into those 2 paragraphs of this first action area and the second action area, it becomes much easier. Okay, so what are the action areas of the Ottawa Charter for Health Promotion? Build healthy public policy, create supportive environments, strengthen community action, develop personal skills, reorient health services. Okay, so when you hear those 5, you need to be able to be like, okay, these are the things that I can immediately link it to in terms of this case study. Alright, so if you have a look at this case study, so I'll give you a minute to just pause and read through it. So basically, what this initiative is, it's a Headspace campaign to ensure that Indigenous young people are able to take charge of their mental health and well-being. Okay, so they're able to talk about the well-being together through a community-based chat feature, videos, and culturally appropriate fact sheets. And it's available for family and friends with a young person in their lives, right? So when you see this, you could link it to strengthen community action, because family and friends of young people are also working towards a common goal of improving Indigenous health and well-being. Then you can also consider creative support environments, okay? Because there is a community-based chat feature and videos that are culturally appropriate, right? So it really caters to the needs of Indigenous youth in a culturally sensitive manner and supports their culture. Okay, so those are the two brainstorm ideas that I would have in my answer, but there are a range of different action areas and examples that you can use from this case study. So, in this exam report, this is what they did. As you can see, the marks were like 2.8 average out of 6, so it's alright. But students are reminded to read the question carefully, as many did not provide a description of the selected action areas and could therefore only receive a maximum of 4 marks. Okay, so as you can see here, it says identify and describe 2 action areas. So you have to be like, build healthy public policy refers to, create supportive environments refers to this, right? Making sure that people feel like they are supported in a safe environment, changing the physical environment, changing the social environment to be more appropriate to talk about health issues. Okay, so in this question, the sample answer says, develop personal skills by, refers to providing education and improving the skills of participants. And then in this Take a Step campaign, they provide practical steps so that Indigenous youth can feel better. Okay, so it provides them with the skills they need to recognize the signs of declining mental health and ways to get better. Okay, and that is really described over here. Recognize the signs that something's not right, provide small practical steps towards feeling better. The other thing is strengthen community action. Right, so this action area works to connect individuals and communities so that they can work together to achieve a common goal. Okay, so there is a community-based chat feature, videos and fact sheets, and is provided to family and friends with a young person in their lives. So that's what I'm saying. They're all working towards achieving a common goal. Okay, so that young people do not feel alone. Right, so it's really important here, not only that you read the question, identify and describe action areas, but you also explain how they're evident and know the action areas of the Ottawa Charter really well. Okay, you will need to apply it to a range of case studies, so for your SACs and perhaps your exam, so really focus on nailing that. Alrighty. Now, the second part to the Indigenous health and wellbeing questions are you knowing your own initiative. Okay, so we covered quitline for the smoking target area, and then for this it's a separate dot point, we're saying an initiative used to address Indigenous health and wellbeing is Aboriginal quitline. Alright, so you might be like, what is Aboriginal quitline? It's a telephone service that Indigenous people can access for advice and practical strategies to quit smoking. Okay, so there's quitline, and then part of quitline is Aboriginal quitline. So it's specific for Indigenous people in terms of it is staffed by highly trained Indigenous specialists. Okay, and it's very culturally sensitive, working in a way that it's also about the non-Indigenous culture, and it's more really specific to Indigenous culture, and the idea of really focusing on community and things like that, and different communication styles. It provides callers with a personalised plan to quit, just like quitline, in a culturally sensitive manner. And again, it's only the cost of a phone call, right? Or free if you're referred to by a health professional. And it's available to all Indigenous Australians, regardless of their socioeconomic status, because it's just the cost of a phone call or free. And it creates a supportive environment through culturally appropriate advice being given in quitting smoking, and developing personal skills. But anytime you're describing this Indigenous initiative, regardless of the one you pick, please pick one that talks about itself being highly culturally sensitive or having Indigenous stuff, as those are the ones that you can really relate to the Ottawa Charter for Health Promotion action areas. So that's a quitline number, and then, yeah. Cool. So make sure you're able to link it to the boys can swim down rivers, bad cats smell dead rats. One of those mnemonics. Well, not the mnemonic, but the actual action areas. Alright? Don't start talking about how it relates to bad and how it relates to cats, okay? Alright. Australian Dietary Guidelines. Okay, so there are 5 dietary guidelines, so we're moving on to one of the last dot points in Unit 3 of Study 2. Okay, and there are 5 dietary guidelines that you need to know. Okay, number 1 is to achieve and maintain a healthy weight. Being physically active and choosing nutritious food and drink that is proportionate to meeting your energy needs. You need to know all 5 of these by heart. Which can be a bit scary, but as long as you can sort of remember the key words, and the more you do questions about it, the more you'll be able to remember these. These dietary guidelines were actually put in place many, many, many years ago by the government when they were like, people are not eating healthily. I know what will help. A huge slab of text. It actually wasn't that effective, so there were more better initiatives implemented, which we're going to be talking about. But this was a starting point, okay? So, enjoying a wide variety of nutritious foods, so that's ADG 2. ADG 3 is limit intakes of food, bad foods. Breastfeeding is what ADG 4 is about. And then storing and caring for your food and preparing it safely, right? So this is about food hygiene practices and ensuring bacteria doesn't enter your food and contaminate it. Okay, the main 3 we're going to be talking about is 1, 2, and 3, but 4 and 5, it's kind of there. But yeah, regardless, you do need to know all 5, okay? So, this is what I'm saying is, they found that this was not that effective in educating the mass population, so they did this instead. A really colourful pie chart that depicts how much of each food group you should be eating. Okay, so we have our grain foods, like our carbs, we have our vegetables, we have lean meats and poultry and protein things, we have our dairy, and we have our fruit. Then we have our discretionary foods, and this is our fats. We also have a tap of water. Okay, so it's really important that you know this diagram without even having to look at it. I know this because I used to look at it in primary school every day. We had one in our classrooms. Maybe you do too, but now you definitely need to know it. Okay? So, it's a food selection tool visually representing the proportions of the 5 food groups recommended in your daily diet. Okay? So, this is the acronym. I have maybe you can use it in your exam as long as you first say the full form and then put it in brackets. So, the ADHD is a visual representation of ADGs 2 and 3. Okay, so ADGs 2 is about eating from the 5 food groups every day and drinking plenty of water. Okay, and number 3 is limit intake of foods containing saturated fat, salt, added sugars, and alcohol. As you can see here, these are the fats because oils contain fats, and these are like also the fats, sugars, sodium, alcohol, etc. Okay, so it really is an ADG. It's a representation of ADGs 2 and 3. So how are they portrayed? So the 5 food groups are portrayed in the center circle, and with drinking plenty of water in the top right corner. Okay, so I highly recommend that you remember that because I did lose marks for not mentioning it once. That tap of water is actually significant. Speaking of which, I'm going to take a drink of water myself. Alright. Then we have ADG 3. Limit intake of fats, represented in the bottom right corner, in the only sometimes and in small amounts section. Also, we call it the discretionary section, but quoting it is definitely fine as well. Okay, so you can say in terms of ADG 2, you can really emphasize that it says carbohydrates and vegetables should comprise majority of the diet, with fats and protein and fruit, dairy being smaller amounts. Okay, so that was how you would link it to the proportions of the 5 food groups. And then drink plenty of water. So as long as you know those 2 things, that ADG2 and ADG3, you should be fine to answer these questions. But sometimes you will need to analyze some strengths and weaknesses. So when we get to the healthy eating pyramid, some of those will make a bit more sense. Okay, so the healthy eating pyramid is basically done by Nutrition Australia, another organisation, and it's a simple visual guide, just like the AGHD, that guides the types and proportions of foods that you should eat every day. Okay, so it's based on the ADG and ranks the 5 core food groups and healthy fats according to how much they contribute to a balanced diet. So one weakness of this is that it doesn't say to limit alcohol or limit other things. It just says limit salt and added sugar. And the actual proportions can be a bit confusing, right? Because it's like not showing carbohydrates and things like in the bottom. And it also shows fruits in the bottom, okay? So people might think, oh, you should eat a lot of fruits, but in fact, fruits contain a lot of sugar, okay? So you shouldn't be having too much fruits each day. So how are the ADGs portrayed in the AG? Unlike the AGHE, it addresses it by stating be active, okay? So it reflects ADG 1, the Australian Dietary Guideline 1, in terms of be physically active and eat food that meets your energy needs. In this, enjoy a variety of food and be active every day. Okay, so that reflects ADG 1. So that's better than the Australian Guide to Healthy Eating. Another thing is that, like the Australian Guide to Healthy Eating, the proportion of the 5 food groups are shown, like drink plenty of water as well. And the choose water with the tick. So that reflects the Australian Dietary Guideline number 2. And Australian Dietary Guideline 3 is kind of reflected, but not to the same efficient extent as this one, okay? Because this provides a range of examples of foods that you should limit. Because some people might be like, oh, technically a hamburger is good, but no. Because it has grains, it has vegetables, but no, this one really specifically ensures that you say only sometimes in small amounts. So yeah, it's really important that you know this. Another good thing about the healthy eating pyramid is it says enjoy herbs and spices. Although that's not in the Australian Dietary Guidelines, it explains that, hey, sometimes the healthy foods can be bland, but if you add spices, it can be a bit more tastier and less painful to eat. Okay. So, now we have a 2021 VCAR question, and it's 6 marks, and you need to select 2 guidelines from the ADGs and describe how each is reflected in the healthy eating pyramid. Okay, so when I say ADGs, we're talking about this one. So you need to select 2 of these and then explain how they're reflected in this one. Okay, basically what we're talking about is these 3 dot points. So, how would you structure this? If it's 4 marks, not 6 marks, 4 marks, it would be 2 marks and 2 marks. So 2 paragraphs of 2 marks. And you need to describe how it's reflected, right? How is it shown? In the healthy eating pyramid, ADG 2 is shown as the proportion of the 5 food groups are shown in a pyramid shape, with the food group of vegetables that should be consumed the most at the bottom, and the food group of healthy fats that should be consumed the least at the very top in small amounts. Not only that, ADG 1 is reflected in the healthy eating pyramid, as it states, be active every day, right? And the Australian Dietary Guideline number 1 says this: to achieve and maintain a healthy weight, be physically active. Okay, so those 2 are reflected. Now let's have a look at the actual sample answer. Okay, so although the wording of the guidelines did not have to be exact, so if you're wondering, it has to be close. Okay, so you do need to know it, but not to like, oh, you said be instead of was, you will still get the mark. Another common mistake was referring to decreasing intake of fats as opposed to saturated fats, okay? So fats can be healthy. There's unsaturated and saturated fats. saturated fats are not as good. So making sure that you differentiate between them. And some people were not able to actually link it to the healthy eating pyramid. So you really need to have that visual image of all the little things on the healthy eating pyramid. And statements that are really broad, like it shows what food you should consume, it's not really talking about it shows it in which proportion in a pyramid shape, with the foods that you need to consume more at the bottom in a bigger amount and foods that you need to consume at less at the top in a smaller amount. That's the level of detail that you need. See, stating that the pyramid is made up of 4 layers with fruit and vegetables in bottom layer shows a greater level of understanding, right? So that's the level of specificity we're looking for. So number 1 in the sample said, limit intake of saturated fat, sugars, salts, and alcohol. This is shown in the healthy eating pyramid in the top left-hand corner, shown by an image of salts and sugar with an X through them. Enjoy a wide variety of nutritious food from the 5 food groups and drink plenty of water. So, wow. The healthy eating pyramid visualizes a glass of water, and the levels of the pyramid contain the 5 food groups: vegetables, fruit, grain, meat, dairy, relating to the guideline 2. Okay, so it relates it to guideline 2 and 3. This would probably, I would say, get most of the marks, but in terms of improving it, you could say that it is reflected, it does reflect this, but doesn't reflect this. And another thing you might say is the levels of the pyramid contain the 5 food groups in the proportion they should be consumed. Okay? Alright. Now, Nutrition Australia, you need to know that Nutrition Australia, who made that guideline, that healthy eating pyramid, actually has a range of other initiatives. So this includes the Healthy Eating Advisory Service. So this provides information and support on nutrition for like organizations like schools and hospitals. Okay, so that nutritious foods are able to be incorporated in like those sort of settings, because schools and hospitals are really important to have healthy options available, because they're the ones mainly saying you should eat healthy. And this service also works with early childhood services, outside school hours care. And then there's also National Nutrition Week called Try for 5. So this is run around October every year, and it's a healthy eating awareness campaign. Okay, so they raise awareness around the role of food in our health to promote and enjoy healthy eating. The campaign last year was get the most out of your veg, right? So it was really emphasizing that vegetables contain a lot of the essential vitamins and minerals and fiber that you need for a healthy diet. Okay. And last dot point is challenges in dietary change. Okay, so you need to know that there are many challenges to implementing dietary change, right? Because the Australian Guide to Healthy Eating, the Healthy Eating Pyramid, and the dietary guidelines, it's easier said than done. So some challenges that make it easier said than done are food security, time constraints and convenience, education, nutrition, knowledge, and cooking skills, and food marketing. Okay, so those are the ones we're covering today. But the other ones that you can also talk about definitely are willpower, attitudes and beliefs, personal preference, influence of family, culture, society, and religion, and health and well-being factors. So you need to know that certain cultures are more likely to consume really energy-dense, oil-dense, fat-dense foods, whereas some are more likely to consume way more vegetable, lean meat-focused. Japanese diet is a really good example of one that contains lots of vegetables and actually shown to promote your life expectancy if you consume that Japanese diet. But if you're consuming something that looks a bit more like this, which a lot of us are guilty of, you're less likely to have that longer life expectancy. And there are many challenges that cause this, it's including this. Okay? So this will make a bit more sense when I go through it. So what is food security? It's when all people at all times have access to sufficient, safe, and nutritious food. Right? So unfortunately, the cost of healthy foods has increased more rapidly than the cost of unhealthy foods. And this is due to many things like inflation and things like that. Lower SES are more likely to experience food insecurity than high SES, socioeconomic status, due to their income or low health literacy. Okay, so when you have a lower income, you're less likely to be able to afford that more expensive healthy alternative, and then resort to something that's more energy dense, processed, and nutritiously inadequate. And not only that, in lower socioeconomic status suburbs, it's really difficult to access nutritious foods because there are loads more fast food outlets. So I know down on Clyde Road, just like within the span of like less than a kilometre, there are 3 Macca's joints, right? So it's much easier to buy Macca's after work or after school than it is to go to Coles and buy fruits and vegetables that could be really expensive and then make something out of it, you know. Whereas fast food is there, it's so easily there. So food security, that's what it means. It can really definitely relate to your geographical location and your income and your SES, a range of things. The other thing is education, nutrition knowledge, and cooking skills, right? So the less nutritional knowledge you have, the more likely you are to consume unhealthy foods because you don't know the risks, right? And you might not be able to assess, hey, I should be consuming less of fats, I should be consuming more vegetables. And there might be difficulty in understanding food labels and nutritional levels. So many people, when the 5-star health rating initiative that I've been talking about was introduced, were like, oh, it has 5 stars, then it must mean that this is the healthiest, like this is healthy. But it might be like a chocolate with 5 stars. It doesn't mean that that's healthy, it just means that compared to other chocolates, it's healthier. So people who don't understand that might be more likely to buy and consume unhealthy foods. And again, low education levels, individuals are less likely to be able to cook something like stir fry, which is nutritious, and would have to rely on the more packaged energy dense foods with loads of sodium, sugar, and fat. The other challenge is time constraints and convenience, right? We live in a really fast-paced world, and meals need to be prepared with that of like, look, I have work in 15 minutes, will I order a pizza, or will I buy a coffee on the way with lots of sugar and grab some hot chips, or will I, make time to make a salad and a sandwich with lots of vegetables? And another example is full-time working parents might purchase convenience food like your bake-home lasagnas compared to cooking fresh meals from scratch, which is healthier. Another example is truck drivers, right? So those relying on trades might rely on outlet food because while they're driving and things like that or near their employment, that might be the only thing available. And then full-time working parents might give their children some money to buy food from the canteen instead of preparing something at home, right? And this is a challenge because, as much as they would want to be healthy, it can be really hard because there are things out of their control. Like, they have work, they need to put food on the table, so this is the best they can do. Then, of course, there's the rise of things like Uber Eats and Menu Log because there's less time pressure. You don't have to go and pick up healthy foods or wait for the delivery guy. It comes even faster than usual. Okay, so with a click of a button, you have dinner ready. So as good as that is, these foods are typically unhealthy, unfortunately. And the last challenge in dietary change is food marketing. Okay, so the influence of social media, it's basically revolutionized the way food is marketed, especially to young people, as you can see by these billboards. There's lots more online advertisements and television things, whereas back in, it's just marketing is everywhere. And when you see unhealthy foods, the more tempted you are to buy it without realizing the negative consequences of that. And yeah, social media and marketing of unhealthy processed foods is really, really common. Just having a look at those delicious desserts on TikTok and Insta, it can be really tempting. But yeah, that's basically another way food is marketed to ensure that you make those unhealthy choices compared to healthy foods, which might have less marketing because there's less of a consumer base for healthier foods, which is better for you. Alrighty, so we have a practice exam relating to explaining the challenges about making changes to making dietary changes. So it's a 4-mark question, and you need to explain 2 challenges. Okay, So you would split this into 2 and 2, because 2 challenges means, you can have 2 paragraphs worth 2 marks each. Alright, so in the first challenge you might say is time constraints and convenience. With the rise of delivery services such as Uber Eats and Menulog, it can be much quicker to buy energy-dense foods, especially for those who are working full-time, compared to cooking and preparing an entire meal from scratch. So this can reduce their ability to make dietary change, to regularly make and consume make meals that are nutritiously dense. Another challenge, so as you can see, I'm using those signifying words. So I've got one challenge, another challenge, and I'm separating into 2 paragraphs. Another challenge is food marketing. Due to technological advancements, food marketing of unhealthy processed foods is more common, leaving individuals to be more tempted to go and consume packaged, processed, whatever you want to say, unhealthy foods, making an individual less likely to go out of their way to buy nutritious food due to less exposure and marketing to it. Okay, so in this case, they talk about personal preference. So like, when you regularly choose food high in salt, sugar, and fat, you actually sort of become addicted to it because it releases dopamine in a sort of addictive way. And then it talks about time constraints. So people are more likely to purchase ready-made processed foods. Alrighty. Now we are moving on to Unit 4 of Study 1. Alright, so we're just covering the very start of this, and there is just one key thing that you need to know. All countries are classified as either high, middle, or low income. And this conclusion is based on GNI. So that's basically an estimation of an individual in this country's, or whatever country it is, personal yearly income. Okay? So GNI is calculated by the following formula. There's total income divided by the country's population. That equals your GNI per capita. Okay, so per person, what is the income? But a limitation is that it doesn't reflect the inequalities, okay? So just because a country has a really high GNI, it might mean that, hey, look, even though there's loads of billionaires in the country making the GNI really, really high, majority of the population is actually really, really poor, okay? So even though, yes, it does, sort of show as like an average indication of like GNI per capita, it also doesn't reflect all the inequalities existing in that country. So these are some examples of like GNI per capita ranges. Every year it changes. So the examples of country in high income: Australia, Canada, Japan, United Kingdom, USA, Ireland, and the GNI per capita is 12,376 and over, okay? So I think for Australia it was like 14,000 or something, or like 20,000. We have Sri Lanka, China, Thailand, Turkey, Malaysia, Brazil. That is in the upper middle income with the range of like around 4,000 to 12,000. Lower middle income is your India, Morocco, Egypt, Zimbabwe, Vietnam, Bangladesh. Obviously, there's way more examples. These are just some, with around 1,000 to 4,000. And then 1,000 and under, that is your low income countries. So Afghanistan, Nepal, Zimbabwe, Uganda, Rwanda, and Somalia. Alrighty, so basically, you do need to memorize these ranges. It's really important that you do. And you need to know examples of countries from each of these categories as to like what their range GNI per capita range is. You also do need to know how to calculate GNI per capita range. Alrighty, so these 2 slides are really important in making sure you get that head start into Unit 4 of Study 1. Alrighty, so that brings us to the end of the lesson. I really hope you guys learnt a lot. If you made it this far, really good job to you. Yeah, just this is a summary, so have a really good look through the study designs, expose yourself to loads of practice questions, and ask anytime you have questions. Check out any of the HR Notes resources. choose my tutoring, etc. if you need anything. So yeah, I really hope you have a good term. Good luck with the rest of, with the rest of VCE, and hope to see you at the next Head Start lectures at the next holidays. Alrighty, thank you guys. Bye.